Hey there, I'm Dr. Monahan from Monahan Dentistry and Implant Center. We are a full-service dental office right here in Mesa, Arizona. And today my goal is to spend a few minutes with you to answer all of the questions you might have about cosmetic dentistry. Now, when it comes to cosmetic dentistry, the most important or the most often question we get is, what are veneers? A lot of people, when they think of improving their smile, the word veneer pops into their mind. I know you've probably heard about veneers, maybe you saw them on the news, maybe you've heard about it with movie stars in Hollywood. To put it simply, a veneer is a covering that goes over your natural tooth. Now, a veneer can be made of different things. It can be made of a fancy kind of porcelain material. It can be made out of a filling material that we use and sculpt right on your tooth in the office. So regardless of what it's made of, the purpose of a veneer is to cover your existing teeth in order to improve the looks. Now, you might want to improve the looks by way of the color. Maybe you think your smile is not quite bright enough. Maybe you've tried some whitening products and your smile's not as white as you'd like to see it. A veneer is really good for that because it goes on top of your teeth and actually brightens the color of your teeth. We can pick essentially any color you want for your veneer. Now, if you request green or purple, I'm probably going to say no. So a veneer is really good at brightening your smile. The other thing veneers are good about is they can change the shape of your teeth. Oftentimes people have a misshapen tooth, maybe a tooth that's too skinny, maybe you have gaps in your teeth, or maybe even the position of your tooth is off where it might be slightly turned or rotated. It could be too short or too long. So all those problems related to tooth position or tooth shape can easily be solved with veneers. When the veneer goes over your tooth, it will be constructed to look like your tooth is actually in the exact right spot and that it's the exact right shape. So the veneer gives you a lot of artistic ability to just create the ideal situation for your smile. Now, most people, they're not just getting a veneer on one tooth, they're typically doing multiple teeth at a time. You can get a veneer just on your two front teeth or on all of your teeth to improve the look of your entire smile. So people often ask me, how many veneers do I need? Well, that totally depends on what you want to achieve. If you want a drastic change in your smile, it probably wouldn't look natural or look right to brighten up just one or two teeth right in the front and leave all the others looking their normal way. You would want to improve your entire smile. So if that's your goal, is to create a drastic difference in your smile, you just basically want to cover all the teeth that show when you smile. So those type of drastic changes, we often term those a smile makeover because we can literally recreate a whole new smile for you in a matter of a day or two sometimes. Sometimes it might take a little longer than that, but you'd be surprised how quickly we can change a person's smile. Now, another common thing we get questions about in the world of cosmetic dentistry is, what about tooth whitening? Does tooth whitening damage my teeth? Will it really work for me? So there's a lot of questions around tooth whitening, and it's become a popular thing. So to put it simply, tooth whitening is completely safe for your teeth. Tooth whitening is basically a fancy kind of hydrogen peroxide, so it does not erode your enamel. But people may get that idea because tooth whitening products, they can make your teeth sensitive temporarily. Believe it or not, your teeth have microscopic pores, and that bleaching product, that whitening product that you use, it actually pulls anything out of those pores, and therefore the small pores in your teeth are opened up and the teeth can become sensitive. Now that might last a few days or a week or so, but generally most people get over that and they feel like it's a fair price to pay for the whitening process. So there's all kinds of whitening products out there. There's over-the-counter products you can buy online or in the store. I've even seen little shops in the mall doing whitening for people. So what is the difference with all this whitening product out there? Well, there are many whitening product manufacturers, and wherever you get your whitening product from, just make sure it is actual FDA approved whitening product. You don't want to have inferior products put in your mouth or on your teeth. You sometimes don't know what's in those products. So make sure it's from a reputable company. Any dental office that's offering whitening is most likely using an FDA approved material that is a high quality material because we want to see results for you. Now, we offer in-office whitening products, and the difference between in-office whitening versus at-home whitening is the products that we use in the office, we actually have to oversee or monitor the bleaching process because we're using an extra strength bleach on your teeth. Now, extra strength bleach, or really any bleach for that matter, it's not good to get on your gums. It can actually burn the gums or just irritate them. So when you have an in-office bleaching, we're going to isolate your gums. That means we're going to put a little barrier or a shield on your gums so none of that bleaching material will get on your gums. It's going to keep your gums more comfortable, and that way we can use a high-strength bleaching product and get a faster or more drastic bleaching result for you. But I am a big fan of the at-home bleaching products that we use. So here in our office, we use custom bleaching trays where we can actually take a mold of your teeth and make these very thin, comfortable trays that you wear. They're made of a clear kind of rubber material. And with your at-home bleaching product, you're going to put just a little dab of bleaching gel in your tray for each tooth. And when you put that tray on, it's going to hold the bleaching gel right against your tooth so that it's going to bleach your teeth over usually a 30 to 40 minute time period. The at-home bleaching products, they come in different strengths. So just talk with your dentist about what strengths might be good for you. Generally, people that have sensitive teeth, it's better to use a lower strength bleaching product. But if your teeth aren't sensitive, just go for the full strength stuff and you'll see faster results. Now, one of the things you want to keep in mind about at-home bleaching products is they don't happen right away. They don't happen immediately. So I tell my patients, don't count on seeing any results for the first 3 days. Those first 3 days, even though you don't see it, it is actually doing something behind the scenes. It's really priming your teeth to see the results that are coming. But if you try to bleach your teeth at home for, say, 2 or 3 days, and then you get frustrated and quit, you're going to see zero results and it will be a waste of time. That's pretty frustrating. So I tell people you got to stick with it. Do it every single day, and 1 week is probably the minimum amount of time that you want to bleach your teeth at home to see results. If you want to see really nice results, you're going to bleach your teeth at home for probably about 2 weeks. You could even go longer, but most people, their teeth are getting pretty sensitive about that week to 2 week mark, so you may not have it in you to go that long. But if you can at least go a week, then you're going to start to see some nice results. Then you could take a few days off of the bleaching product, and then you can come back to it a few days later and say do another 3 or 4 days, and that's going to turn out really nice. Now, if you've tried bleaching and whitening your teeth and you're still not seeing the results, let's talk about some other kind of treatment to brighten up your smile. And that brings us back to something like a veneer. So again, veneers, it's part of the smile makeover process usually. And like I mentioned, a veneer can be made of a filling material. We call that composite. Some people nickname that bonding. And the nickname bonding comes from the special kind of glue that we use to glue on a composite or a white filling material to your tooth. We can also use porcelain products. And generally speaking, if you get a porcelain veneer, it's going to be a little more expensive. But what's nice about porcelain products is they don't fade over time, whereas some of the other materials, over the years, the color may fade. So it may not look as bright on, say, year 5 as it did on day 1 that you had it put in. That being said, just talk with your dentist about the various options for veneers, and you guys need to discuss your specific case and decide what's best for you. There's pros and cons with every way you go, so it's important to get a customized treatment plan. There's really no cookie cutter way to improve a person's smile. Now, when it comes to finding a qualified cosmetic dentist, how do you choose, or how do you really find that professional? I think word of mouth is great. If you know somebody who has beautiful veneers or they have a wonderful smile and they can refer you to their dentist, that can be a great way to find somebody. The other way is just go for a consultation and meet the doctor and really talk about your options and see if the options they're presenting to you fit with what you have in mind. If you feel comfortable in their office and you feel a sense of confidence with them, then that's probably a good choice. Now, I want to give you an idea about veneers, for example, that could be very helpful for you. Now, when I do veneers for a patient, especially porcelain veneers, I love doing what's called a smile mock-up. So what does that mean? Before I do the entire veneer process, I'm going to take photos of your teeth, and I may take 3D scans of your teeth using a 3D camera, or I may even take some molds of your teeth. And that's going to help me create a blueprint for your smile. Now, before we actually do anything to your teeth that would be permanent, we're going to create a blueprint and then transfer that blueprint to your teeth. So I can use some filling material and place it right on your teeth using the mold or the blueprint that I created, so you can actually have a chance to demo your new smile. And what's really cool about that is now you can wear that new smile home, and it's really like a temporary version. That's just so that you can see and feel what your teeth would look like if you had veneers. And the reason why that's so important is because if you start the veneer process and you're getting your teeth drilled on or shaved on, you don't want to do that and go down the wrong path. You really want to have a result that you know you're going to like. So one of the things I love offering to my patients is to be able to have them see what the final result would look like. Now, one last question that we sometimes get when it comes to smile makeovers is, what is the difference between a veneer and a crown? Now, a veneer, like we talked about, is a covering for your tooth. So a veneer typically is going to just go on the front of your tooth, and it may slightly wrap around the sides of your tooth or cover the biting edge of your tooth, whereas a crown is going to go 360 degrees around your tooth. Some people call a crown a cap. And the reason it's called a cap is because it totally engulfs or goes over the top of your tooth. So when would you need a crown versus a veneer if you're getting a smile makeover? Well, if you want to do a veneer, say on this back tooth, and that back tooth already has a very large filling in it, or maybe it has an old crown on it already, you can't really go backwards from having a crown and then just having a veneer on it. You really are dedicated, or you're kind of locked into having a crown if you already have one on your tooth. Or if your tooth has a large filling, a crack in it, anything that would put that tooth at risk, when you're going to go to put your veneer on there, sometimes you opt to do a cap or a crown that you can then match to the veneers. So when you're smiling, it would just look like a beautiful tooth or like a beautiful veneer. You can't really tell from the outside if it's a crown or a veneer. So in summary, a crown is best when you need a lot of structural reinforcement to your tooth. So if you have a front tooth that's broken in half, something that would really compromise the structure, that's when a crown is really good. And I've often done a combination of crowns and veneers right next to each other. And in the end, the smile just looks seamless and beautiful because they're all created from the same material. They're all done in the same lab technician's hands. So regardless of whether you're getting crowns or veneers for your smile makeover, I think the final result will come out really nice. It's more a matter of your personal needs. So I hope I've answered some of your questions you might have had about veneers, cosmetic dentistry, whitening. And if you have any more questions, don't hesitate to give me a call. We are here to answer all of your questions. Again, I'm Dr. Monahan from Monahan Dentistry. Give us a call at 480-764-2111. And I look forward to meeting you soon.